Hello, and welcome once again to What Nobody Told Me After 65. Today, I want to talk to you about seniors and medication. Managing your medication is serious business. Medication safety is paramount to your overall health and well being. Everybody is taking a pill for this, a pill for that. And I found that there is a term being used called polypharmacy. What that means, it is the simultaneous use of multiple drugs to treat a single ailment. Meaning you may have dementia, you may have high blood pressure, you may have whatever, but more of your medication is being used to treat the one thing. And it's become a global issue. Approximately 30% of Americans, adults actually, who are in developed countries, 65 years of age or older, take 5 or more medications. Now, while these medications offer health benefits, they may also cause and contribute to other issues. Um, Recently, I began taking a new medication, and my pharmacist, who is on my primary care team, talked to me about the medication. We discussed its benefits, and we talked about some of the side effects. So I was okay, um, and the medicine was ordered. Later on, maybe a week later, the Walgreens pharmacist called me and wanted to go over the medication. Um, she wanted to know how I was making out. And I said, well, I've only been on it a week, so right now I'm not able to tell you, exactly how I'm making out with it. It needs a little more time. But we talked about the side effects, we talked about the benefits. She went over some of the other medications that I'm taking that, um, had she not looked at everything that I took all at once in its totality, um, I might have had an issue. Something might not have worked with something else. So, big kudos to Walgreens for uh, doing their due diligence. Not everybody does this type of monitoring. I have to tell you, I was shocked to find out that many doctors are prescribing, just writing a script for um, medication that you may not need. Um, and certainly somebody needs to be looking at this because as seniors, we're already having issues with memory loss and what have you. Um, and some of the challenges for seniors and medication is you have to remember to take the medication and to take it at the right time. They have little pill boxes that help you and what have you. I have taken medication. We all may have taken more than I was supposed to because I forgot that I had already taken it. Um, your doctor may change a dose or the frequency, and we get used to taking 2 pink pills, 1 yellow pill, at 9 o'clock every morning. If the doctor changes that, now we got to get used to a new routine, and that can be confusing. Sometimes special instructions are hard to follow. The names of these medicines can be difficult to remember and to pronounce. I've taken to writing it down phonetically so that I'm able to remember the kind of medication that I'm taking. Sometimes they have unpleasant side effects. And like most people, we don't want to take a lot of pills. I'm interested in reducing the number of pills that I take. Medication changes your eating habits. Sometimes it makes you feel like you're already full, and therefore you don't take to eating properly because you feel like you're full or you already ate. However, the other medicine that you're taking requires that you eat, particularly if you're on blood pressure medicine. That medicine requires that you eat. If you don't eat, you'll begin to be lightheaded, get clammy hands. I take blood pressure medicine, and so I know what I'm talking about. Sometime in the day, throughout the day, I might start to get sweaty hands or feel a little lightheaded, and I have to say to myself, oh, did I eat? Eating is fundamental. You have to eat. As we get older, our eating patterns change, our habits change. We don't need as much food, but a lot of times we take medication and we want instant gratification. It doesn't always work like that. Medicine takes time to get in your bloodstream and to work, and so that is the purpose, for taking particular medications. In order to keep up with your medicine, you can use medication boxes or pill organizers, like I said. You can keep track of your medications on a paper. You can make a chart so that you know. And then have a specific place to put all of your medicine. All of my medicine is in my cabinet with my water glasses. I have 4 or 5 different pills that I take in the morning, and they are lined up with my glasses because that's where I get my glass for my water to take the pill. And that's what triggers me to know it's time to take your medication. At night, the medicine that I have to take at night is in my nightstand, right next to my bed. So I take it before I retire for the evening. You have to recognize that dosages might or should change with your age. If you're taking 50 milligrams of something and you've been taking it for a number of years, perhaps as you get older, your doctor should take a look at either reducing it or removing that medication altogether. And you have to monitor how medications work with each other. Even over-the-counter medications can have an adverse effect if you're not paying attention. And again, we're getting older, pills I've been taking for 5 or 10 years, I just take them. As a matter of fact, while I was talking with the pharmacist from Walgreens, she asked me about a particular medication. I said, am I taking that? Well, I was, but I take it in conjunction with 2 other pills, and I just pop them and it's over and done with. You have to check in with your doctor periodically. Be responsible for your own medication management. Be responsible as much as you can, or let a family member know about your medication so they can help you keep up with it. Now, there are special challenges for people who have dementia. They don't remember that they took it or didn't take it. So people who have memory issues might forget what medications that they're taking, or repeat the dosage, or forget to take doses, or to forget why they need to take this medicine. It's important that people with dementia have a good overall care team in place, and they have people who they can trust, because as you know, with dementia, it's a matter of trust. Somebody's telling you something new. Can I trust that? The bottom line is, as you get older, you're more likely to need more prescriptions that help to treat various health conditions. But it can be a struggle trying to keep track of these different medications. And this polypharmacy thing, this is really something. Pharmacists, though, play an important role in the deprescribing process. Deprescribing, meaning you don't need to take as much, or you don't need to take this medication any longer, and your pharmacist is well aware of what you are taking because they're the ones that fill your prescriptions. So it stands to reason that you need a good care team in place, whether you're suffering from dementia, whether you're just a senior citizen. Life is challenging enough, and to remember to take your medication is really important. I can't stress it enough that managing medication is really one of the things that helps to keep you going, helps to keep you alive. Yes, we're taking more medication. Yes, we find that we have more medical and health issues. But with the advent of modern medicine, there is no reason that an individual can't live a long and very productive life if they manage the medications that they are taking. I am hoping that you get some good information from some of the things that I'm sharing with you. This information that I got tonight came from bannerhealth.com. I'll be putting that in the comments if you want to go and read more about it. I also got some information from the National Institute of Health. That's my go-to people. They take care of our president. They take care of the higher-ups in government. And it's an awesome organization. And I trust them. So remember, managing your medicine is important. You need to take it, and you need to stay on top of it and check with your medical provider to make sure that nothing has changed. New medicines come out, old medicines go away. I'm taking a pill, a 3-part pill, as a matter of fact, that handles cholesterol, blood pressure, and it used to be I took 3 pills. Now it's 1 pill for the 3. And I like that. It helps me. Again, you're responsible. You have to do your homework. You have to ask the questions. There's no crime in not asking questions. Whoever your provider is should be happy to answer those questions for you. Again, I've enjoyed talking with you about seniors and their medication. I'll have more information. I found some other websites that had some information that's going to be helpful, and I'll post in the next coming weeks. Again, thank you for subscribing. Thank you for sharing. I'm on the move, and I appreciate it. So, subscribe, share, hit the like thumb, and also the notification bell so that you are notified when I upload new content. And as usual, remember, you don't know what you don't know. Thanks for listening.